This is Janet Halloran, and I'm here at the Arlington Youth Counseling Center. And I'm with the two directors, Colleen Legier and Linda Suzuki. And they'd like to tell you a little bit about the program. It's a fabulous program, unlike anything in our surrounding towns. So I'm gonna toss it to Colleen, and she'll tell you about the program. Colleen?
Sure. So Arlington Youth Counseling Center is a division of Health and Human Services for the town of Arlington. And we serve children and families who either live or attend school in Arlington. And we see children as young as 3 through the ages of 21, and then they're adult caregivers. There are a few things that set AYCC apart from other agencies and surrounding communities. One is that we serve community youth exclusively, and the other is that it is our mission that we see anyone within Arlington community regardless of their ability to pay. So we take all major insurances, but we also recognize that there are many families who lack insurance or do not have adequate insurance to cover the cost of services. So we provide grant funding to those families to make sure that there are no financial barriers that prevent people from accessing needed mental health services. We see clients here at the Whittemore Robbins House, which is right behind the Fox Library. Nope, the
Robbins.
Robbins Library. So we're here behind Robbins Library,
Yeah.
and we see families primarily out of school time, and we also have clinicians in all of the public schools in Arlington to provide individual counseling and some group work as well.
That's fabulous. It's a fabulous program. I didn't know a lot about it, so I'm glad we were able to bring this to the Arlington people and know what's available for them. So, Linda, did you want to talk a little bit about the program and what you do? You're the clinical director.
So I'm the clinical director, and I've been here for quite a long time, so I'll share a little bit about
That'd be great.
my impressions of the agency. You know, I think that AYCC really exemplifies a community mental health center, and the roots of this agency started from the community itself. Its response in the 70s to a suicide. There was a drug overdose, and families were very concerned about the youth and gathered together and formulated, I think, essentially like the Board of Youth Services. And from that, they had a very informal outreach service to youth in the communities. And at that point in time, they considered themselves like street outreach workers. And then it became more formalized. This agency is a licensed mental health center, and we're really very proud of the support that the community has given us, and happy about being able to deliver services to Arlington families. So yeah, I think it's very unique and it's really special, and it reflects the town that we're located at.
That's fabulous. That's fabulous. And particularly where it will address people that can't afford it. And we have such a need today to have counseling like this. And so how long has this been how long has it been, was it established?
I think it was around probably the mid-70s.
Wow, it's been around.
Early mid-70s, right.
Wow, that's fabulous.
And the mental health needs of youth and families
Oh, yeah.
is greater than ever.
Yes.
And there aren't many places that families can turn to that accept insurance.
I agree.
And so we're just
Especially those who are public health insurance, who have a mass health product. There aren't many service providers anywhere in the
That will
area
take
it.
who accept that.
Yeah, and that's sad. Where do they turn?
Right.
You don't have any place you can turn. But that's why I support it wholeheartedly, both financially and emotionally. And one of the things, if you could tell us what, I think we have an event coming up, and how anyone watching this documentary could contribute to the program. How would they go about that?
Sure. Well, first of all, thank you for your sponsorship.
Thank you.
We have, it's the upcoming annual gala, and it's our primary fundraising event each year. I think this year is our 9th. And we're honoring Carlene Newell, who is a member of the Board of Youth Services. She's also a health educator for the town, has been serving in both roles for, I think, over 30 years.
Wow.
So we're really excited to recognize her this year. It will take place on November 1st at the Arlington Town Hall, and we welcome anyone in the community and beyond to attend. It's $75 per ticket, and people are also welcome to sponsor. We do have a website, perhaps you could share it. It's ayccma.org/gala. So we're looking for sponsors, people to attend, or people who would be willing to donate, because the proceeds from the gala or any donations come right back here to the center for direct services to both subsidize for families who cannot afford the care, and also just the general operating cost. I think many of the reasons why other community-based mental health centers have closed over the years is that the cost to run them far exceeds sort of the revenue that we're able to generate. The reimbursements for mental health care just are not adequate.
No, for sure.
We have a wonderful team of providers. I don't know that we mentioned that, but we have
Please do.
well over 20 providers. It's multidisciplinary. We have licensed independent clinical social workers, psychologists. We have clinical interns, licensed mental health counselors. We also have a psychiatrist who's part-time on staff, and
Wow.
clinical nurse specialists who prescribes medication for clients who need it.
Wow, pretty broad.
It's a wonderful
Very
team.
broad. Well, I went to the gala last year and I thought it was fabulous. The food was great, the entertainment was great.
It's a fun
It's
event.
a
It's
fun
a great
event, and I have to say I felt very comfortable and meeting a lot of people that I knew there, and it's a great organization and it's well
Thank
worth
you.
attending. So I hope
Thank you.
you all are able to attend it in November. Anyway, this is we're signing off, and we hope that you'll give a call. Take care. Bye bye.
Thanks, Janet.